Welcome to North Country Commerce, a community and business service of the Plattsburgh North Country Chamber of Commerce. My name is Gary Douglas. I'm Executive Director of the Chamber, and each week we try to focus on a different topic of interest to people in the North Country, and particularly of interest to business people in the North Country. Services that are available, things that the Chamber is doing, perhaps news and timely events out there that are of interest to business or affecting business. This week's topic really kind of touches on all of those things. Health insurance. And before everybody picks up their clicker and changes the channel, we're not going to spend half an hour here really doing a hard sell on insurance. So please don't leave us. Really what we're here to do is to give people out there an opportunity to know of choices that are available to them, and particularly during the month of November this year, during the entire month, which is what we call an open enrollment season. That means it's a particularly good opportunity, in some cases the only opportunity for folks to take a look at their choices, change their coverage, look at other plans, or if they don't change their coverage, at least reassure themselves that given other choices that are out there, the coverage they have now is the most cost-effective for them and is really the right product for them. Why is the Chamber in the health insurance business? I mean, there are lots of insurance agencies out there, and folks might wonder why chambers do that. Really, almost all chambers do that. It's a very long-standing and traditional service, realizing that people in business, particularly small business, don't have traditionally the same kind of access or just staff available to them to help them make choices and to line up health insurance for themselves, their employees. And so chambers have really been doing this for many, many years, really serving as a conduit to help go out there, line up products, and help with access to health insurance, help with affordability of health insurance by monitoring those products and working on behalf of our members with health insurance providers to bring the most cost-effective and the highest quality possible products online, and then to help members understand them, help the business community get the information, the good information that they need to make well-informed choices that are right for them, and to help them do that as often as possible. So really it's a small business service. We have several hundred health insurance accounts through our chamber. They range from self-employed people to, in some cases, some fairly larger employers who find it advantageous to have their health insurance administered through the chamber. So it's really open to a wide variety of folks, and nonprofits, I should mention as well. It's not just business. Anybody out there who's in business for themselves and their employees, or is a self-employed person, or churches, nonprofit organizations, local governments, any kind of employer or business out there is really eligible to take a look at what the Chamber has to offer. Some of the things that we do here at the Chamber that we actually take pride on is actually trying to provide some added value to the services that we provide in connection with health insurance. So it's not just, well, here's a sheet, here's what's available. If you want to buy it, go talk to somebody and buy it. We try to do more than that, and more than some chambers and other associations do, who also provide access. We have a full-time professional health insurance administrator on staff here at the Chamber, whose job full-time is to help business people out there assess their choices, answer their questions, assist them with questions or problems after they're in our program, to do the billing and the paperwork and so on throughout the year, and to give business in the North Country maybe kind of that added advocate and that added service between that small business and the providers, which is something that very often can prove valuable. And that particularly becomes valuable each year when we go back to our providers and we reassess all the products that we're offering and make changes every year. I know I've been here 4 years and there hasn't been a single year that we haven't added some products, changed some products, dropped some, put new things onto the product that weren't covered the year before, so that every year it makes sense to take a fresh look, because it's probably not exactly the same products out there. And that's because we hear from our members what they're asking for. And it changes a little bit every year. And we try to respond to that by dealing with our providers and changing the products around a little bit to respond to what we're hearing. Our health insurance administrator here at the Chamber is Mary Yetto, who's with us. Mary, welcome.
Thank you.
Tell folks why it's advantageous in your view to be looking through the Chamber to meet their health insurance needs.
Thank you, Gary. First of all, I want to tell you that I'm so excited about the 1997 insurance programs that I could probably take up the next 30 minutes telling you about that. However, I'll leave the details up to the very reputable representatives that we have today from each carrier. I'll let them tell you about the new plans. I will say, though, that the new plans you're going to hear about today and the plan designs and changes in some of the older plans are as a result of requests from our current participants. So today you're going to find that you have a much broader choice in 1997. We're going to be offering 2 indemnity plans, 2 HMOs, 2 point of service, and 2 dental plans for the very first time ever. We're very proud of that. So we're listening to our members, we're hearing you, and we're making changes accordingly. We're in looking at why it is advantageous for you to come through the chamber. In my opinion, we offer the best service to you. It is a very difficult decision in determining what you need for health insurance, what your employees need, because sometimes your employees cannot get across to you what they need for health insurance. They're just simply not aware of what is the most cost-effective choice for them. Some people enjoy the HMO plans, some people enjoy the indemnity plans. However, regardless of your situation, we can help you make that decision, which is a very difficult decision. Again, we can meet with you personally, you can call me, we can discuss things over the telephone, or I can come to your place of business, we can talk to your employees, talk to you, help you decide which plans, and unless you want to offer all plans to your employees, in many cases you can offer all plans to your employees. Some may choose an HMO, some may choose a traditional plan. Really depends again on their needs. So we're here to serve you and do that for you. That way, in the end, your employees aren't paying for something that they feel that they're not taking advantage of. Also, we're here to process your paperwork. And if you have people or have had people in-house in the past who have had to process paperwork for changes in health insurance or new applications, trying to keep up with those changes in the paperwork is very time-consuming. We understand that, we do that here at the chamber, and we do that promptly. You make the telephone call, we send you the change form, if it's applicable, and we make that change for you. If there are any problems with that change later on, you call us and we take care of that. So you never really have to have any direct contact with the carriers. And not that they couldn't service your needs, they can do a very fine job doing that. However, as you know, dialing the 1-800 number at times and you're frustrated and you're trying to get a person on the other end of the telephone, it's not as easy when you know you have a designated person to call on. However, when you do reach them, they always have the answers. But we will return your call within 15 minutes and not more than 1 hour, depending, of course, upon the weather. We have a terrible snowstorm, we're not here. But the majority of the time, the turnaround time is anywhere between 15 minutes and 1 hour. We will get the answer for you if we don't already have it. And also, it is very simple to join the chamber. How do you join the chamber? Well, you can become a member easily by contacting us, getting information, packets, applications to sign up. And once you become a member, it's very easy to join our health insurance plans. You would review the brochures that are sent to you, and again, we can meet personally or we can discuss over the telephone which plans seem to be most advantageous to you. And we ask for 20 days in advance to process the application before we give you an effective date. New hires become eligible as they're hired per your company policies. In other words, if you have a 90-day probationary period, you have 30 days from that date in which to file the application and get the effective date for the first of the following month. So it's very easy to add new hires. It's very easy to make a change through us. We do all of the billing. We will bill you quarterly. We will bill you monthly. We bill you quarterly on a regular invoice. You can opt to pay that monthly or quarterly. If you do pay it monthly, we simply send you monthly statements to remind you of your next payment due. So we take care of all of those hassles for you, and I think most people in today's business, as busy as they are in business, look at it at just that as a hassle with paperwork.
It takes something that small business probably dreads having to deal with when they're busy trying to run things out front and keep their business going. We basically serve as their back office for them, at least when it comes to their health insurance. We'll take care of that whole end for them.
And like Gary said, we continuously are evaluating your needs. We're listening to you. We are watching the health insurance trends in an effort to offer you the best plans in the future. and the carriers that we work with are very easy to work with, and again, they're experts. They're always willing to change things accordingly, and that is why it is best to come through the chamber.
And choice is really what it's about. We don't have one carrier, one plan, because frankly anybody that's offering that is telling you that one size, one plan fits all, and we all know that isn't true. One plan doesn't fit all, and there are more choices in the market today than ever before, and whoever people are getting their health insurance through should reflect the fact that there are more choices out there because people need more choices. Family sizes are different, circumstances are different, the types of coverage that people want that may depend in many cases on what types of services they tend to use most. That can affect whether you care about having prescription coverage, for example, or not, whether you want dental or not. It isn't so much a matter that one is better than another or better than another, it's that they're all different. And we've taken a great pains to make sure that the policies that we're offering, the coverage that we're offering, each has its own different wrinkles so that they're all going to fit different people, which means we can virtually guarantee that anybody that comes to us through health insurance is going to find something very close to their perfect choice, whether it's cost or types of services they want covered or the way that it operates. And with that, we're happy to have with us representatives of all three of our carriers to briefly describe what the products and programs are that we have through the Chamber, so that folks can have a sense of what they may want to come in and ask us about. And we have with us from Blue Shield of Northeastern New York, Meg Browland. Meg,
Hi.
welcome.
Thank you.
And we also have representatives from CHP and MVP, who we'll get to, but we'll start with Blue Shield. And Meg, we have three different programs right now through Blue Shield. We have what's known as Secure Blue Extra. We also have Secure Blue, and something that I know folks have been seeing advertised out there called Health Now Flex.
Right.
So tell folks out there what our three packages are.
Thank you. Blue Shield's always tried to offer choice. As Mary and Gary both said, we look at our consumers' needs and the changes they may want. I'll touch briefly on what we're having this year, and then I want to really go into our new changes for 97. Currently, through the Chamber, we have Secure Blue Extra, which is a traditional type indemnity plan you've grown up with. You go to any doctor you wish, anytime without a referral. It comes with a $10 copay, a $240 deductible for hospital charges, and drug coverage. Student coverage to age 25. And one thing I want to talk about with the indemnity product we have is a program called the Blue Card program, which is countrywide. And with the Blue Card program, you can go to any state, and if you see a doctor who participates with the Blue Cross Blue Shield plan of that state, it's treated as one of our participating doctors. So you literally have participating doctors across the country. The other plan we currently offer through the Chamber is Health Now. That's Blue Shield's HMO package. Blue Shield is new to the HMO market. We're not new to insurance. We've been insuring people for more than 50 years. But we recently got into the HMO market, and over the past year, we spoke to our consumers to see what kind of changes would they like. First, I want to touch on the new indemnity product we'll be offering for 97. It will be Secure Blue, not Secure Blue Extra, although Secure Blue Extra is still available. We're adding Secure Blue to try and keep the premiums down somewhat. And the way it does this, it has the same benefits as the Secure Blue Extra, excuse me, with the exception that instead of first dollar coverage with participating doctors, the patient will pay 20% of the bills that come in. We will pay 80% until they reach an out-of-pocket of $1,000 a year. This keeps your premiums down. At that point, excuse me, it then reverts to a 100% contract with participating doctors. The one I'm really excited about, though, is the enhancement to our current Health Now product, and we're calling it Health Now Flex. The reason it's called Flex is it's giving you, the consumer, more flexibility and choice to really customize the contract to best suit your needs. The Chamber is going to be offering a $15 copay as they have now on the Health Now. You, as the consumer, for the same price, can choose a standard option, which is what you have now, standard $15 for PCP, that's primary care physician visits, $15 for specialists, or you can choose the custom option. Under the custom option, you can have the choice of a $15.15 copay or a $10.20, whichever you individually feel would better suit your family's needs. The second change is we've added some additional benefits at no extra premium cost. Each family member will get an annual dental cleaning and exam. an annual vision exam, free eyeglass lenses, and you'll pay only a copay for your frames and your contacts. Another nice feature of the custom option is there's an out-of-network feature. This means you can at any time go to any doctor anywhere without a referral for a $250 a year deductible for out-of-network services only. That's the only deductible you would have. And then it would be an 80% contract, just like a regular indemnity. But this is at the cost of an HMO. And also with either our standard Health Now Flex option or custom option, we have away-from-home care. Now, some nice features in away-from-home care. First of all, we have something called urgent care. Now, urgent care is not emergency care. We do have emergency care anywhere in the country. If you have a true medical emergency and you need to go to an emergency room, you can do that. Urgent care is something new. This means you, the subscriber, decide if you need to see a doctor. Maybe your child has an earache, or you have a sore throat, or a sinus infection. It's not a medical emergency, but it's urgent to you. You're away from home, you want to see somebody. You call the number on the back of your card, and we will set up an appointment for you with a doctor as close as possible to where you are, and you will pay just your copay. Also, we have guest membership. This is basically for people who have children away at college in a different state, say. The child will pick a PCP here where the parents reside. So when they're home, that is the doctor they would go to for their referrals. They also will pick a PCP in the state or county that they are attending college. And that way they can see a primary care physician, pay just their copay wherever they happen to be. And that PCP is chosen from a list of doctors offered by the Blue Cross Blue Shield plan of that state. And as always, we do have a service office here in Plattsburgh. It's right here in West Bay Plaza, and I can be reached there Monday through Friday.
So a whole lot of new products there. It's not the same old. The folks that come to us to ask about Blue Shield 5 years ago, it was one plan. You know, take it or leave it. This is what's on offer. Now there's several products just through this one provider that we work with. And open enrollment period is also an opportunity for folks that are already in Blue Shield. Maybe they're in Secure Blue or Care Plus or something. It's their chance to look at the new offerings to make sure, well, do I want to stay with the plan I'm in now, or maybe this is when I want to make a change. Or it could be to another provider and vice versa and so on. But even within that provider like Blue Shield, it's a good chance to assess the plan that you're in and make sure it's still right for you and still the most cost effective. And control those costs. Everybody wants to control costs, and so open season is really about that. We're also very pleased to offer access to Community Health Plan, which has been doing a terrific job serving the community here in the Plattsburgh region for a number of years now. And I know I always take pains also to thank them for the great help they've given in bringing new doctors to the area and really helping to build the capacity of this area to serve folks out there. And Cheryl Blanchard is with us from CHP. Cheryl, tell us about our CHP product.
Thank you very much. I want to begin by telling you that we do have 2 new providers coming in January, and I'm really excited about that. Community Health Plan does have 2 full-time recruiters, and we do recruit doctors into the area. And as many of you know, Plattsburgh is very needy for doctors. Before we get started on the benefits, I just want to talk a little bit about the affiliation with Kaiser Permanente.
Mm-hmm.
The CHP Kaiser Permanente affiliation is now official, and that means that we can move forward with our dealings with them. What it means to you as a member is that you will have access to a much larger network. Community Health Plan, well, Kaiser Permanente, as you know, is probably one of the largest HMOs in the nation. So that gives us quite an extensive network. Now we'll talk a little bit about the benefits. Mary has books available for anybody interested in Community Health Plan here at the Chamber. So if you're interested, get a hold of Mary and she'll see that you get a brochure. With Community Health Plan, once you decide to join, you're asked to select a primary care physician. Now that's a doctor that either works at our health center on Margaret Street or an affiliated staff doctor in the area. Our network has really grown in the Essex County area. If you haven't seen a book in a while, you probably want to take a look at it. This primary care physician will be responsible for providing, arranging, and coordinating all of your health care needs for a $5 office visit. With Community Health Plan, there's no deductible, so you're covered right away on a first dollar basis. You come to one of our doctors, you pay your $5, and you get all the care you need that day. If you need to see a specialist, your doctor will help you select, and we do have a network, again, in this book. We use both Plattsburgh specialists and Burlington specialists, so you will be referred to a specialist. Each referral is written for a specific amount of visits. It could be 1 consultation. It could be for 6 months, go as often as you need, and then at the end of the 6 months, you need to get another referral. That's where the managed care part comes in. The actual managing of the care is the referral base. So you're referred to your specialist for all the care you need. Your inpatient care, if you're admitted to the hospital with this program, is 100% after you pay a $240 copayment. So the maximum that you're going to have out of your pocket is $240, and that covers all expenses incurred in the hospital. The only thing it doesn't cover is your television and telephone, so it's a pretty comprehensive program. The drug coverage with this program is a 50% coverage, and that's at the time of purchase. So you show your card to a participating pharmacy, and they give you half off right then and there. There's no paperwork, there's no claim forms, there's no paying up front and waiting to get reimbursed. It's a very easy program to use. Probably one of the biggest questions that's asked me is, how am I covered when I travel with CHP? CHP is pretty local. We cover Vermont, Massachusetts, and New York. So people ask me, what happens when I go to California or Florida? How am I covered there? Well, you're covered for any emergency or any onset of illness. There are two types of emergencies, life-threatening and non-life-threatening. In the case of a life-threatening situation, I don't care where you are, go get your care. Call your CHP provider as soon as you can to let them know what's going on. Your doctor here knows you. They know your family history, your medications, and they can help that stranger treat you. If you're in Florida, you have a car accident, this doctor doesn't know you. So your CHP doctor can see that you get a high quality of care by seeing that you get the treatment that you need. So go get your care if it's life-threatening. If it's non-life-threatening, we want you to handle that differently. Because we're affiliated with Kaiser Permanente, we have a lot of access to HMOs throughout the United States. So we're going to try to use an HMO if there's one available where you are. And that keeps your costs down. An average emergency room visit is around $250. So we want to try to keep you out of that environment if you can. I know here in Plattsburgh, our health center, we're open from 9 to 9, Monday through Thursday, and we're open Saturdays for urgent. So if there's a problem before 9 o'clock, you simply can come into the office. If it's after 9 o'clock and you need to be seen, they will open up the health center and see you there. We have a procedure room where we do stitching and casting, things of that nature. So you can be seen at the CHP Health Center. Our members find that a very valuable service. Also the office hours, being open till 9 o'clock, that's a real big, employers like that, employees like that, it's very valuable. The other thing I'd like to talk about at our health center is we do have 4 excellent pediatricians that are all taking new patients, new CHP patients. I know pediatrics in the area right now is tough. So we did recruit, that's one of our new doctors coming in January, will be a brand new pediatrician. So it's really going to open up access at CHP for members. So to join CHP is really easy. You fill out an application. There's no pre-existing condition clause, so you're covered right away. You just simply need to call Mary and get a book, and that will take care of joining CHP.
Thank you. We're also pleased to have with us a representative of the newest provider in our chamber family, although they've been out there for a long time and have a long record and are certainly a high-quality participant in providing health care in upstate New York, and we were very happy to welcome them on board earlier this year in the interest, as we've said along the way here, of providing more and more different kinds of choices so people can make sure that the coverage they select is as closely tailored to their needs and what they can afford as possible. Ed Wagner is here from MVP Health Plan. Ed, welcome. And
Thank you.
Tell us a little bit. We have 2 products now through you folks.
That's correct. MVP is happy to be offering 2 separate and distinct plans here to the Chamber. And as you're aware, just a little while ago, we opened up our own branch finally here in the Plattsburgh area, right here in the West Bay Plaza. What the MVP Health Plan can offer, first of all, as an HMO, Health Maintenance Organization, is a plan that has paid in full hospitalization. No $240 or $500 or $1,000 copay, deductible, or whatever. If you go in the hospital to have a baby, you go in the hospital to have open heart surgery, it's a paid in full benefit, including the assistant surgeon, the anesthesiologist, and anybody connected with that hospital stay. Our program includes a prescription drug card, a $5 drug card, or if you prefer name brand, it would be a $10 copay. That's through a national prescription card company called PSCNY, Pharmacy Services Corp. New York. They in turn contract with virtually every chain, Fay, CVS, Rite Aid, even Super Shop and Save, Price Chopper, and the last I looked, almost every local independent neighborhood pharmacy also participates. Again, it's a $5 drug card, unless of course you prefer the name brand. What we are adding to this program this year is student to age 23 while they're away at college. And we, excuse me, I got the same problem as everybody else. We're also adding coverage for eyeglasses or contacts. We will split the cost of glasses or contacts on a 50-50 basis. So if you bought a $100 pair of glasses, we would cover $50. If you bought a $150 pair of glasses, we would cover $75. We do cap the reimbursement at $75, so you do not go out and get fancy frames at $300 a pop with the tinted lenses and all that type of extras that can be put on. Our program, as I said, has a paid-in full deductible, no claim forms, and it basically covers a vast majority of the doctors in the Clinton, Essex, Franklin, St. Lawrence, all the way down to Glens Falls and even further south. You have a choice of primary care doctors from Rouse's Point with Dr. Racines, etc., right down through Plattsburgh, Keysville, over to Lake Placid, Tupper Lake, Saranac Lake. It's a $15 copay. After that, everything else is covered in full, including all diagnostic testing that the doctor may order, right up through and including MRIs, CAT scans are covered at 100%. In addition, we are instituting as part of our standard basic plan, at no additional cost, dental care for kids. And it's so new, I have to go to a cheat sheet to look it up. And one of the things that we're covering under dental care for kids is exams once every 6 months, bite wing x-rays once every 6 months, routine cleaning, scaling, and polishing of the teeth once every 6 months, fluoride treatments every 6 months, sealants once per tooth per child, space maintainers, and peripheral x-rays as needed, along with complete x-rays once every 36 months. A second plan that we are putting in place here is a point of service, which is exactly as I just described, but does give you the flexibility of going to non-participating doctors subject to a deductible of $250, and then it's covered at 80% up to $500,000. Works exactly the same way. You still select a primary care physician. However, if you prefer to go to New York City or Boston for medical care, then after you pay your $250 deductible, we would cover it at 80%. Last I looked, we have probably the largest list of participating providers in the North region. MVP has been an HMO since 1983 down in the Schenectady area and has slowly expanded. We're now in we're in 2 states, New York and Vermont, and looking to expand into 2 other states as we speak. That's the overview of the MVP health plan. And
Okay.
Thank you for having me up here again, Gary.
Thank you. Well, there you have it. In a sense, a whole lot of choices from 3 quality providers, choices within each one of those. And as you can see on this flyer we put out, something also new coming on board. We will have, beginning with the 1st of January, we are lining up also a standalone dental plan. In addition to it being added to MVP's feature, those folks out there that want separate dental coverage with any of these providers, or they could be with some other provider someplace else, not even through the chamber, but would be interested in a dental plan, come and talk to us about that too, because that is something new. And we have 2 free health insurance forums for folks out there during November if they want to come in and meet with these folks and get an even more detailed overview and get their questions answered. On Tuesday, November 12th at 8 a.m. at Windows Restaurant in Plattsburgh. And then again on Thursday, November 14th at 7 p.m. at Lum's Restaurant in Plattsburgh. They're free. We just ask you to call, let us know that you're planning to come, so we have a head count, and it'll be a chance to get a one-on-one, first-hand look at all of this, help make a choice, or just call us here at the office, 563-1000. We'd be happy to meet with you, answer all of your questions, and help you get set up. Thank you, and be sure and tune in again in the future for North Country Commerce.